If you've got a basal cell on the face anywhere, size of a dime,
Okay.
what's the treatment?
Yeah. Well, the standard treatment has been surgery for a really long time, okay? And generally that's still considered the gold standard. You know, if it's a solid type basal cell, which is the more common type, or superficial type, those are easily treated with just regular old excisional surgery.
Shave them off, or you have to go a little deeper and close the wound?
Well, if we're talking about face, you know, cosmesis is more important.
Yeah.
Okay, so there are some tricks like you're talking about, something called a curettage and electrodesiccation, where we scrape it off and cauterize it basically, and that's a great treatment, really quick and easy and low risk of infection and bleeding, low cost. Not a bad scar, but maybe not a scar you'd want on your face. Okay, so on the facial skin, we're more likely to do excisional surgery. And again, if it's a basal cell that's in a location that doesn't require major reconstruction, like maybe the tip of the nose, and it's a type that doesn't have, as my patients say, roots, then we can just do that with simple excisional surgery. That's still the standard of care. But there are certainly cases where patients have that same little dime-sized basal cell you're talking about, but in a location that makes it much more difficult. So again, we talked about the tip of the nose, or near a lip, or near an eyelid, and you know, those are locations where you don't have a lot of extra skin to close the surgical defect, and it might be important for a patient to have Mohs surgery.
What's Mohs surgery?
Yeah, it's named after Frederick Mohs, who was a turn of the 20th century physician at Mayo Clinic, who described how you could take out a skin cancer. His term was micrographically, where you take it out and you can then immediately freeze it and check the margins and tell where you need to go back. And then that way you can conserve all the healthy tissue that you can. You're not taking out large margins without needing to. You can conserve tissue, but you have a very, very high rate of getting that completely clear. In fact, it's considered to be 99%. That being the case, today I actually excised a patient who recurred after a Mohs procedure. So nothing is 100%.
Yes.
And when basal cell is so common, you're going to get exceptions to practically every one of our rules. Yeah. The interesting new things in basal cell carcinoma is, you know, we've never had a chemotherapy drug for basal cell carcinoma. Haven't needed one a lot, okay, but there are certainly people who sadly will let these get very, very large, and it's, you know, stunning to hear this, but there are people who let them completely remove an ear, or completely remove a nose, or take off a huge portion of a face. And there are cases of metastatic basal cell carcinoma, so this drug, Araveg, can be used to either treat the basal cell carcinoma completely, or more commonly to shrink it down to size where it can be treated either with surgery or with possible radiation.
How does the medication work? If you've got a basal cell, how did you pronounce it?
Araveg. Yes.
Araveg.
Well, we always laugh at the pathogenesis of this one because there's an immune pathway called the hedgehog pathway. I didn't name it.
Hedgehog, would it be easy to remember?
Exactly, and so it inhibits a protein in that, and that's what causes the death of the basal cells. So
when you
immunology.
Use chemotherapy, and when you use medication, you have to go after that? Do you have to go then and excise what sort of remains?
It certainly can be the case. It certainly can be the case.
Results pretty good treating basal cell cancers?
Generally, yes, can be very, very good.